Your health, your story. Let's make it extraordinary. Hi, I'm Dr. Manasa Reddy. Today we have Dr. Sayuj Krishnan Garu, consultant neurosurgeon, Yashoda Hospitals. Let's welcome him. Hello, sir.
Hi, hello.
How are you, sir?
All good, thanks.
Okay.
How are you?
I'm good, sir. Thank you. So, sir, difference between a neurosurgeon and a neurologist.
Well, many public may not be aware of this thing, but
And they don't even know whom to consult first.
okay. So, both the neurosurgeons and neurologists have separate teams who address the same issue, which are related to the nervous system, which includes brain, spine, and the peripheral nerves, and the autonomic nervous system, which is the fourth part of it. So, when it comes to training, the neurosurgeons take either surgery or into a direct branch and then opt for neurosurgery, which is a 6-year course training altogether.
Okay.
It can be either surgery 3 years and then 3-year neurosurgery, or it can be complete 6-year neurosurgery. I did a 6-year neurosurgery training.
Okay.
So when it comes to a neurologist, he takes a general medicine initially and then goes for neurology. There are some 6-year training courses as well. So in India, this is the standard of this thing, but in US and other countries, it may differ a bit. But overall, this is the training-wise difference. But when it comes to patient care, it comes to diagnosis, to pinpoint the diagnosis and everything. A neurologist is the first person who consult first. And then if it requires a surgical intervention, they approach a neurosurgery. That is a usual protocol, which should be followed ideally.
So most of the people have a doubt that once if they get a spine surgery done, if they get operated, they cannot walk. Is it true or myth?
Yeah, people often ask us also, like when they come for surgery, they genuinely ask this question: if there is a chance of complication. I will not say no. Like a spine surgery is a complex, obviously a complex organ, and from the brain, all these nerves pass through a tiny tunnel inside the as the spinal canal. So, there is definitely a risk of complication. But with the technology and everything of late, the technology has improved with this endoscopic spine surgeries and other navigation systems and everything. The complication rates have come down. And beyond that, what is the indication for the surgery? That is also different. So if the patient comes with a terminal or the condition where the spinal cord is already damaged to an extent, then the surgery carries more risk. Then we'll have to use advanced technologies like neuromonitoring, where you can on table we can monitor whether the patient is developing any weakness during surgery. That's called neuromonitoring, SSAP, MAP monitoring. These are technologies which aid in patient care and avoiding this kind of complications.
So just now, as you said, when a normal back pain, when a person has a normal back pain, when does this again patient has to go for a surgery?
Yeah, a simple back pain,
when it turns to
when it turns to a
surgery, when that case turns to a surgery.
See, 90% or maybe 95% cases of back pain doesn't require surgery. So our body has an excellent healing mechanism from inside. So how it adapts to all this, pain in a way is a trigger point saying that something is wrong with my body. I have to address it.
That gives a signal. Yeah.
So it's up to us to understand it and then take care of it. If it is you know that it is telling you something and you address it, that may be a posture correction, that may be some kind of bad pillow that you are using, a wrong kind of a software continuous use of laptop. These are all the things that they can address at that point of time. If they don't address at that point of time, then we have to jump in and then treat. So there is a preventive aspect of it which people usually don't understand. And then they come to us and they ask for a surgery and then they are scared about it. But there is a lot of preventive care that can do prior to happening a surgery, which people should be aware about it.
We ignore it. Those signals we ignore it.
Yeah. And when they come for surgery, they usually are scared if they do surgery, some complication can happen. But this was the prior to surgery, they didn't take care of all these things.
Preventive measures and all.
And even surgery always is a damage control. We can control the damage, but we cannot never put a new spine back. That is always with posture correction exercises and all those things.
Is spine surgery the last option, sir? Or can it be treated early? It will be a life changer.
So that it definitely depends upon the indication. Like see, as I told earlier, if it is for back pain, we have to know what is the cause for the back pain and then treat according to that. If it is a simple disc herniation or if it is a lumbar canal stenosis, the indications and the treatment differ. Depends on it. And if it is a spinal tumor, then definitely that may be pressing onto the spinal cord, and if you are not going for a surgery, there may be a chance of impending weakness or paralysis. So in that case, surgery is always life-saving. But in a case of a disc herniation or a spondylosis or something which is just disabling and limiting your work or lifestyle, it may be delayed, and long-term studies show that even surgery or versus this thing, long term you can pull through without surgery also in some cases. But that you have to consult the multiple doctors and then take second opinions and other things, and then you have the option to decide whether to go for surgery in those cases. But when it comes to spinal tumor or other conditions which require or trauma with spinal cord injury, all this may require urgent surgery, which can be life-saving as well.
So what is slip disc? Recently, you might be hearing most of the cases, slip disc and all. It is even in younger people also. So what happens in exactly slip disc? And without surgery, can it be treated or healed?
Yeah, slip disc is a colloquial term. So if you ask me about a disc as such is made up of collagen material. It has a central nucleus called nucleus pulposus and a covering called annulus fibrosus. So because of the disc, usually what happens is as we age, the water content in the disc becomes lesser. That's called a disc desiccation.
Okay.
And this is an aging process. Our body ages and this occurs. But after that, what happens is then sometimes if we exact causes nobody knows, but most of it can be genetic as well. There can be a rupture in the nucleus, outer covering the fibrosis, and then this nucleus can come out.
Okay.
And then it can be called a disc herniation or disc bulge or disc protrusion or disc sequestration. These are the various terms that we use for this particular pathology. So it can impinge on the nerves and cause pain over the lower limbs or the back pain. When it comes to lower limbs, we call it sciatica.
Okay. So how it is treated, sir? Surgery is definitely needed or it can be healed?
So whenever a patient comes to me with a sciatica or a back pain first of all, I don't advise surgery. I try for conservative measures with posture correction, physiotherapy and medications, NSAIDs and other medications. So body has got a healing mechanism which can repair it. If it is a recent disc bulge, maybe 2 to 3 weeks we'll see how the body acts on, heals it. So you may have heard so many people going for Ayurveda and then curing it.
True, yeah.
So that is not because of the Ayurveda, because of the body inherent healing mechanism.
Okay.
The repairing, it has got an inherent mechanism of repair. Just you get a cut in your body and that heals on its own. Same way, the disc damage also repairs from itself. So you'll have to give time for that.
Okay.
That's a reason for that.
Okay. So if you see these days, lifestyle changes, because of lifestyle changes, too much usage of mobile phones. When you use, our position is different. Our posture will be different. And if you see software or any other working seating positions and all, so that there are different postures and all. Because of this usage in long run, there are again spondylitis, nerve damage and all. So how to overcome it?
So there's a general term for that is called tech-neck syndrome.
Okay.
Tech-neck syndrome means that technology, software people are more used kind of developing that. So in simple words, how I tell these patients to is that our head carries a weight of around 6 kilogram weight, the skull and everything. The spine is like a pillar supporting this entire weight. So with each forward degree bending, the weight of because of the gravity, the head weight falls onto the ground, and that entire stress can come to the spine.
Okay.
So that puts pressure on these nerves and other things. But that is a mechanical strain which happens with your bad posture. The moment you step forward and the angle, the forward angle causes a lot of strain over especially over the cervical and lumbar, because these are the moving areas. The thoracic area, the rib cages and supporting it. But these areas are more prone to develop these disc herniations and this secondary to it. not just because of the posture alone. Continuous posture is the more issue. So if it is a dynamic, if it's a sports person who is always bending and coming back to this thing, that stretching is good for spine. That strengthens the core muscles. But continuously,
Prolonged use of mobile phones or
when you are
post-
sitting like this, these back muscles, core muscles we call, these become under tension, and then they don't get back to this normal position. And you must have seen all ladies and everything. Life is always a kyphosing event. So you always tend to bend towards because of the gravity force and everything. But like, if you like, there is a lot of genetics also involved. There are some modifiable factors which can, if modified, can lead to a better outcomes in cases of spine pathologies. But like, one should be aware of their posture. I always tell them when you that it's not easy, but if you keep in mind, like, always this ear should be parallel to the shoulder when you sit, and when you can use a lumbar support while you drive, or when you are using a computer, you have to keep the screen straight towards forward your eye level. This, and mobile also, you have to keep a mobile stand or keep in the eye level when you use it. So these are the simple things that you can follow to avoid all these problems.
But so once there is nerve damage, can it be healed normally without any surgery?
So nerve damage in the sense, if there is a disc herniation and it is pressing onto the nerve, there are, as I told earlier, pain is the first symptom. So that you have to listen to the body and then address it at that point of time. You can use hot formation, cold form, all these simple techniques to treat it. But then later on it can progress on to numbness when it involves the inner part of the nerves. And then you can get nerves and numbness in hands or legs.
Hands and slowly on into the legs too.
Also. And then that third stage is the motor weakness. Muscles can become weak or atrophied also. So like, the warning signs, if you address it early, then the future further progression can be delayed or treated accordingly. So depends on like what stage we are picking up this issue.
With technology, how is endoscopic spine surgeries or minimal invasive treatments has done a massive change to patient recovery time?
All right. So this full endoscopic spine surgery, which is a spine surgery which I adopt, I do usually recommend to patients also. There is a concept of posterior tension band in spine. So we always thought that the bone is the main support for the spine. But of late, the literature, the evidence suggests that posterior muscles over these muscles also play a crucial role in the support for the entire body and the structure. So traditional spine surgeries, when you cut open the muscles and go inside the spine, this muscle become atrophied over a period of time. They lose the strength. So like, is there a way to reach directly into the spine? So the endoscopic spine, if you put a dilator, we can go without disturbing this muscle. We can dilate it and go reach the pathology which is causing the issue. So this posterior tension band preservation, the muscle preservation, is the newer technology which with which full endoscopic spine surgery, uniportal or biportal both, is addressing these issues. So this is a recent evolution. The optics, endoscopy optics, all the technologies, also navigation, everything is helping in aiding this technology.
So all these technologies are available in our hospital. We are doing it.
I do this kind of surgeries regularly.
So if you see these days, even in 20 years, people also, young generation also complain a pain in neck and even in spine. So is it really a new epidemic now?
Well, we don't know by literature wise. Studies are there to. There's something. There's an interesting study called the twin spine study. They conducted studies in twins who are like in different jobs across. Like one is in software, one may be in sports also, and they followed it up for a period of time. So interestingly, they found both develop same kind of disc pathologies, whether they are active or sedentary. So this is we see nowadays, every social media, everyone is saying that all these problems are occurring, but is it evidence based? So we'll have to, otherwise people will get scared also, that young people are, when you ask the question. But if is the evidence supporting it, we don't know exactly, because the most of it is that twin spine study suggests that most of our this thing is genetic. not just a lifestyle modification alone. So there are some modifiable factors, just like we are talking about software, like technical syndrome and everything. But there is a major component or manufactured, the collagen, other spine, bone and everything is manufactured in such a way that the genetic plays a role in it. We can of course modify it to some extent, but some are, we are born with it and we have to live with it. So like to be frank, I don't know how to answer a question, but like this study lists against that, the myth that newer people are developing that. Maybe we don't know like exactly, we have to study it further and then see it, how is it.
What is the reason for it and all, we doesn't know.
Yeah, because earlier people used to walk miles and everything, and then we used to have a core strengthening. But how much it is really like putting into like the effort, like we still don't know.
Okay. Can yoga and physiotherapy, sir, can these really replace surgeries?
Well, I had one interesting patient who came to me with, he just wanted an MRI to be done. He underwent a kind of therapy outside in some place, not yoga, some kind of marma chikitsa and something. And he wanted to get the MRI repeated to see if it has changed the pathology inside. And when he did the spine, all the problems were still there. So if there is an issue, pathology inside, this is a mechanical problem. Just like that table that is there, it is there. But the symptoms related to it may, like it is inside the brain, our perception of it may change plus or minus. But the mechanical problem, whatever is going to stay, whether you do whatever treatment. But like surgery, whether to do it or not, it's up to that person's disability of that at that point of time. But like the inside the pathology is going to stay, whatever we do.
It won't change.
It won't change.
It only changes in our mind, and it
perception.
may slightly change or may not change in the pain and all also.
Yeah, and the pain is a perception inside the brain, of course. And that doesn't necessarily depend upon the disc herniation, amount of disc herniation also. It varies also. Some people tolerate more pain.
Yeah.
So for them, they can carry on with work also. So it depends. Like it is all individual.
So, sir, if you see now, chiropractic is more in trend now.
Okay.
So, how dangerous is it without untrained people, and they even crack the bones or back also?
Yeah.
So, how safe is it?
So I'm not a chiropractor, but I don't know this. I not studied the science behind it, so I'm not confident enough to say in someone else's profession as well. But what I understand is, if there is a definite pathology inside, like a impending disc herniation, which can cause cervical compression, and then in such cases, or a tumor impinging on the spine, in those cases, it is prudent not to do it. Like, but see, it's maybe 1 in 1,000 or 1 in a million who develops that complication. So those, whenever you are looking at social media, all these things, those may not be 1 in the million, which may get away with the chiropractic measures.
True.
But there may be a 1 in 1,000 or 1 in 100, which can develop a complication out of it. There was an incident where in spa where they used this head wash. Patient was suddenly giving head wash and that developed vertebral compression. That means that patient, that particular lady or man who had this problem, had a cervical spondylosis, and suddenly when they predisposed to this thing, developed the issue. So who develops, we don't know. Like,
we never knew.
We don't know. So it's always prudent to be like a bit careful when doing all these things.
After brain surgery, sir, once the surgery, brain or spine surgery is done, when can a patient normally walk, sit, or they can go to work?
Well, it is purely subjective. Like if the brain tumor is purely like non-eloquent areas, we call it non-eloquent areas of the brain where not much of function for the brain is there. Like from some areas of the brain doesn't have that kind of motor function or other like critical functions. In those areas, tumors are removed also, like, and they will get away, the headache and everything is over. They then get back to work very easily within 1 week or 2 weeks, like that. But when it comes to a tumor that is involving the motor cortex or even the deeper structures, which are the eloquent cortex areas, So in those areas, patient has a chance of already having a weakness or something, which may require rehabilitation, physiotherapy, and everything to recover. So there is a regime for that, and they'll have to follow that and go. Like if it is further treatments are required, brain tumor may be requiring chemo radiation and other treatments, adjunct treatments as well. So in this case, like we cannot exactly like getting back to work may be a bit delayed also as well.
But again, in spine surgery, it involves our muscles and all again, right, sir?
Yeah, like but like that's what like latest evidence says we have to get up and walk immediately. Like we don't advise bed rest after spine surgery.
Okay.
We make them walk on the next day or with a sometimes with a brace or without a brace. Nowadays people don't use a brace as well. And the endoscopic spine surgeries, most of them discharge on the same day or the next day. So like see, earlier we used to adapt rest and bed rest and everything. But as I mentioned earlier, the posterior tension band or the core muscles, if you are on bed rest for prolonged time, these muscles go into atrophy.
Okay.
And the strength of the muscle, the spine weakens. So the evidence says you have to get up and walk so that the muscle strength develops. And then the bed rest concept is not there that much now.
Is it true that once someone has a brain tumor, they definitely need a brain surgery, or it can be treated without non-surgically also?
Well, brain tumors are categorized into two. One can be benign or can be a malignant tumor. Benign is simply means it won't grow after you remove it. Malignant may grow again if you remove it. And again, depending on the site of the lesion, as I mentioned earlier, some non-eloquent lesions can be managed without surgery, and if it is benign, based on the radiological evidence, we know MRI wise or CT, all these are showing a small lesion within the scalp or the location also matters. If it's outside the scalp or inside the scalp, in the bone, inside the eloquent area of the brain, all this location of the tumor matters.
Okay.
If it is in a critical area of the brain, which is pressing onto some critical structure inside the brain, which are called the eloquent structures, then it may require surgery.
Okay.
And like if there are some other modalities as well, like stereotactic radiosurgery, which are like other non-surgical concepts, which even for some tumors of the brain, like schwannomas, less than some 3 centimeter, 2.5 centimeter, we can adopt without surgery radiosurgery as well.
Okay.
These are the concept and even smaller lesions, radiosurgery is an effective option. You don't have to cut through the skull and then do an open surgery.
Okay.
And gamma knife radiosurgery, all these are like technologies which are available. So you don't always need a surgery for a brain tumor.
Okay. So how do you decide, sir, to do a open spine surgery or a minimal invasive surgery?
Well, it is earlier there should be like a certain list of condition where you have to go for open for this kind of surgeries and keyhole for this kind of surgeries. But it is now mostly surgeon dependent. If a surgeon can do an individual surgery at a 2 level with the disc with the endoscopically, then he can address it very well. So, but like a surgeon who is trained in the traditional part of the surgery, he may require an open approach. So, whichever surgery you are doing, the patient should be the priority without getting into complications and getting him or her back to work. So that should be the priority rather than the mode of when it requires an open surgery, you have to go for it. There's there's nothing like endoscopic spine surgery will work and you go search for endoscopic spine surgery. When you have to do it in open surgery, you have to adopt that. Like maybe you can take multiple opinions, but when it comes to some pathologies which needs open surgery, it has to be done open.
Okay.
But certain conditions, the endoscopic spine surgery techniques is advancing, and the indications are also like changing based on that.
Okay. So let's talk about something, sir. So let's talk about something like human brain or spine. People having so many myths about it. You wish that they stop believing it.
Well, there is people think that we use only 10% of the brain, like otherwise we'll all be like Einstein or something like that. But that in a myth is in some way, because this functional MRI studies and everything shows that most of the brain is active. In a way, where we utilize that part of the brain depends. We may be diverted to our energy may be diverted to something else. So like a genius like Einstein, you would have utilized it for the science and other things. We may be channelizing into some unwanted things. That's all. That doesn't mean that 10% of the brain is only we are using. Or our brain is always active even at sleep as well. So it's all about channelizing our energy into something productive and then putting it to work.
Thank you so much, sir.
Yeah, thank you so much for having me.